Hi, everybody. Welcome. We're just going to give it a few minutes as people are entering the webinar from the, I don't know, virtual lobby, I suppose. All right. I think most people have entered. It's 1:01 Eastern time, so I am going to dive in because we have a full hour ahead of us. So thank you so much for everybody who's taken the time to join us here today, or might be watching this recording at another time if you weren't able to join us. My name is Karen Dietrich, and I am the Director of Advanced Care Planning Canada at the Canadian Hospice Palliative Care Association. So for the next hour or so, my colleague Mary and I will be providing some information about Advanced Care Planning Canada, which is an initiative of the CHPCA, Canadian Hospice Palliative Care Association, with a particular focus on our work to make this program more accessible, lessons we have learned, how we've applied those to our tools and resources, and how we hope you might be able to take some of those lessons learned and apply them back to your work in advanced care planning, whatever that might be or might look like, or if you are considering participating and joining and starting your advanced care planning journey. So that project was made possible thanks to a funding contribution by Health Canada. So I do want to take a moment to thank them for all of that. We definitely would not have been able to undertake this 2-year project without that support. So as I mentioned, today we will take you through a few different elements. We'll talk a little bit more who we are, where we've come from, how we view advanced care planning, some important trends that I think frame why we believe this is particularly important at this moment in time and moving forward. We'll share some insights from our latest advanced care planning poll. So we do these every couple of years. And then we will talk about the project and some new resources. So we have a lot to get through, but before we do that, I do want to pause and take a moment to acknowledge that I am joining from the unceded territory of the Algonquin Anishinaabe people. And you'll see there that we have a small but spread team. So we are spread across different parts of this country. And so the land acknowledgement that we choose to use includes all the different territories that our team members are joining us from. So I am here in Ottawa, and Mary is also joining from Ottawa. You might see a few other boxes depending on what your settings are like. So you might be able to also see Tara joining us. So she is also located in Ottawa. We're the Little Ottawa Trio, and this is the team that will be making this possible today. So Tara will be our tech support and all things questions related. So if you do have any issues with sound or seeing things, please feel free to put those in the chat. And if you have questions in terms of content for myself or for Mary, please use the Q&A function. That will just help us to make sure that we can keep track of all of those questions, and we can either answer them directly in that response through that feature, or we can bring them forward and address them throughout the presentation. So that's how we'll try to manage it. We'll keep an eye on that chat, but it does get quite busy when we have a larger number of participants. I also would like to raise awareness of the call to action number 22 from the Truth and Reconciliation Commission of Canada's report. This is one that we at CHPCA feel most resonates with the work that we're trying to do and the mission of our organization for equitable access to quality hospice palliative care. And so if you haven't been able to take a look at that report, or you haven't looked at it recently, or aren't really sure what resonates most with either your work or how you walk, how you choose to engage in reconciliation. And I think that first part is important, acknowledging the truth of the history that we came from. So I just wanted to pause and share a little bit about that before we jump in. All right, so who are we? We'd like to know a little bit about who you are as well. So this also gives everybody a chance to test out the polling questions. So we'll have a couple of polls throughout the session, as well as some discussion questions where we'll ask you to respond in the chat. And so we'll start by launching our first poll to help us understand where you are joining from. So if you can take a second and just complete that poll, we'll give you a few minutes. Not a few minutes, a few seconds. Wow, you guys are pretty fast. We've already got about 80% of people who've responded. All right. We will pause there. I think we've got almost everybody. And I'm going to try to share the results and hopefully you can see them. So from there, you'll see we've got we've got a large contingent from British Columbia. Wonderful, welcome. Healthy from Nova Scotia and Ontario, Quebec, wonderful. Newfoundland, wow, we're pretty spread out. That's wonderful. So polling works. That is good. That is helpful. Thank you so much for participating in that. And as I said, we'll have different polls. If you have any issues with the polls, feel free to put your answers in the chat. Oh, Australia. Welcome. And Yukon, oh no, Paula, I'm so sorry. We will make sure that we update that. No problem on that front. So as I said, we're all learning about the poll features. So thank you so much for answering that. And as I said, if you don't see a response for you in the poll, you can put it in the chat and we will make sure to check that out. So what about Advanced Care Planning Canada? What the heck is that? So Advanced Care Planning Canada is a national collaborative project that has been led by CHPCA since 2008. It evolved from some wonderful work out of the Fraser Health region and Calgary regions of British Columbia and Alberta, who really were pioneers in the area of advanced care planning in Canada. And so it was really a chance to learn and leverage from the great work they were doing and to try to spread those learnings across Canada. This led to the development of a pan-Canadian framework, which was last updated in 2019. So I believe it was the last in-person gathering under this project prior to the pandemic that led to the updated framework. And this framework really is the essence for what we do, where we go, how it drives our work so that we can ensure that it is meeting the priorities of different stakeholders from across this country and is really meant to share our learnings. So that's a big part of what we do through this work is we try to focus on what is common about advanced care planning, regardless of where you're living or working in Canada. And then we direct to more local resources where those resources exist, or we partner to help to develop some of them. So some of our work, as I mentioned before, would include those polls, different campaigns. So Advanced Care Planning Day is April 16th. So we'll give you a little bit of information right at the end about that work. And then we're always working on different tools, resources, educational opportunities to try to help raise awareness and understanding of what advanced care planning is and why it's important. So this next poll is to help us better understand who is on this call. So Tara, if you don't mind launching the second poll. So we'd love to know a little bit more about how familiar you are with advanced care planning. And there should be a few different options for you to choose from. So we know that different folks have different perspectives on what advanced care planning is. We will get into our definition of what that is or isn't, and why that's changed over the past few years. I would say that that framework I talked about really did create a shift at the national level in terms of advanced care planning and our work within that space. So, wow, you guys are okay. These responses came flying in. Perfect. So most people are, hold on, I'm very visual, so I always find it helpful when you can see the results. Most people are very familiar, which is great. And for those who are joining us who don't really know much about it or are very unfamiliar, I'm hopeful that you will leave here feeling a lot more familiar with it and that you will be motivated to learn more. So thank you so much, everybody. This is really helpful for us to understand and tailor our content moving forward. So as I've said, there's been a shift since that 2019 Pan-Canadian framework. And this shift really has moved us away from advanced care planning as end-of-life care planning and more upstream as part of a life planning model. So planning earlier and as part of just like you would plan for your finances or your retirement, really shifting that upstream. So our definition of advanced care planning really focuses on that process. So because we are moving our focus upstream, when there isn't a crisis, when there isn't so much emotion and panic, that means that we have to revisit it regularly. And even though we always talk about revisiting it, even early days as, something that you don't just do once, stick on a shelf and never think about, but that we're thinking about and communicating the kinds of health or personal care that we would want if at any point in our lives we weren't able to express that anymore. So it is not solely about end of life care, but it absolutely can include that. And it is for every age and stage of health. And for anyone familiar with that framework that I was talking about, it did have a life planning model in it that looked a little bit different than what I share here on this screen. So this is one of the examples of an adaptation to our models and our approaches from our accessibility work. So thinking about plain language, so where you see money used to be finances, and community wasn't as highlighted as actually, it wasn't highlighted in the previous model. So just recognizing that community, whatever that means for you, it could be community supports and services, it could be your informal community, it could be your cultural community, really plays an important role as we're planning for the future. And so just being more mindful of all those different components that we think about, be it financial, legal, our health or our social services, and our community networks. Why is this important? So most of you indicated that you are familiar or very familiar, so this shouldn't be a surprise. But for those of you who are not familiar with it, it really is one way that we can reinforce person-centered care and making sure that the care that someone receives is tailored to their individual wishes and preferences. It can reduce anxiety and distress for everyone involved. So that would be the individual who might be completing their advanced care plan, those around them who might need to speak or communicate on that person's behalf if they're not able to, because they'll know what they wanted, and for the healthcare team to be able to make sure that they are supporting the family and there isn't that added distress of, am I doing what's right for the person in front of me? Am I doing what they would have wanted? So it's not what I think, it's what they would have wanted. And then support for health system priorities of patient safety and quality improvement, again, and people-centered care. So those are just some of the reasons that we believe advanced care planning is so important. A few of the trends that I wanted to highlight. This is not a new one. I think most of us are like, oh yeah, we've been hearing about this for a long time through different ways too. So this is not a surprise, but it is important because as we get older, we experience more health issues. We also live with more disabilities. So this is something for us to think about, that these conversations, we need to be having them sooner rather than later, and that there's going to be different levels of engagement with our healthcare system as we get older. Again, this is not kind of a surprise to many people. I think one of the learnings we've had is around disability in Canada. And so so people age 65 and older are more likely to have a disability than younger individuals. So again, we all have heard about the aging population. There's a lot of discussion around retirements. There's different factors that have really the economic impact, the big wealth transfer. But this is not one that's often talked about. And so as we age, we are more likely. And then and they're also more likely to have a higher number of co-occurring disabilities. So think about what you think disability means for a moment, and I'll just let you pause with that. The other component that we wanted to highlight is that the majority of people living with disabilities state that they've experienced one or more of different barriers to services. There's a whole bunch of barriers. There's 27 listed in this survey from Stats Canada, but some of those include the design and delivery of programs and services and communication. And so when we think about what advanced care planning is, it is really a core part of advanced care planning includes communication and programs and how they're designed and delivered. If you're out there doing community programs or awareness raising programs, educational programs, we really need to think about how we're designing these programs and the ways that we are communicating ourselves as part of our program delivery or amongst our own family members or whatever that might be. So that in particular caught our attention. So back to, what does it mean to have a person living with a disability? Who does that include? So it is quite inclusive. And for our work and our project, we did take a very broad approach to disability. So it can include any impairment, so physical, mental, intellectual, cognitive, learning, communication, or sensory, and it can be permanent, temporary, or episodic in nature. And by this very definition, many of us have already lived with a disability at some point or are currently living with a disability. And the likelihood that we will at some point in the future is also extremely high. And so this is just something that really came to the forefront as we were doing our research around this project and the importance of this work for everybody involved. And the last kind of trend, I guess, that I want to highlight is the impact on caregivers right now of that aging population. So 1 in 4 people identify as a caregiver, and 1 in 2 will become one in their lifetime. That's a very high number, especially considering that many caregivers, when they are surveyed, they do not identify as a caregiver. They identify as a sibling or a partner or a friend. So we do know that there is a huge amount of support that is being provided by individuals in our communities that is not paid, and that many of them, 69% of caregivers, report deterioration in mental health. So thinking about why ACP is important and that reduction of distress component, this is a really important time to be thinking about ACP for ourselves, but also for those that may have to care for us, and trying to mitigate for that that confusion, that fear. We all come from a place of love. We all do this because we care for people. Well, sometimes we need a bit of direction and guidance. So we are just curious because in this work, often we talk about doing advanced care planning, we talk about how important it is, but doing it ourselves can be challenging. It can be easier to say, yeah, you should do that. Have you done it yet? Oh, no, a little bit, maybe. So I'm just curious if you have ever had an advanced care planning conversation. So I'm not asking if you have an advanced care plan. I'm just curious if you've had an advanced care planning conversation. So thinking or talking about your preferences, your values, your wishes, your beliefs, who that person might be. There's different components to advanced care planning. So if you could launch that poll question, Tara. And this is a yes, no. So there isn't a clear definition. This is just if you have participated in this either yourself or with the people that you work with or for, if you're joining us here more from a professional perspective, or both. I know prior to starting in this role, I had never heard of advanced care planning. But if you'd asked me if I had conversations about things related to advanced care planning, I would have said yes. So for those of you who are like, well, I don't know, I wouldn't call it advanced care planning, but now that I know what it is, I guess I did, you can say yes. All right, perfect. So the majority, large majority, have. And this is great. And this is something that when we do our polling, the way that we ask our questions, we don't ask about advanced care planning up front. We provide definitions and we ask about different components because this remains a reality that advanced care planning is not a common term that everybody knows or hears about. So thank you to everybody who participated in this. I will review a little bit about that 2024 poll. So, oh, sorry, before I get into the poll, because the poll was part of the project. So our advanced care planning project was, again, I think we've kind of walked you through that in the introduction of this, where we think about that context and we think about advanced care planning as a tool that we can use to align with the mission of CHPCA for that quality, equitable access to the care that an individual would want. But unfortunately, a lot of what we see out there is not necessarily accessible. So this project really focused on how do we change that? What can we learn and what can we share in terms of creating more accessible tools, information, resources, program design? So we started with another poll. So this is very in keeping with the previous polls that we've done in terms of the scope. So over 3,000 Canadians from across Canada. Usually it is done in the early part of the year. It is available in English and in French. And this year, because we were focused on accessibility, we did oversample people who identified as living with a disability to make sure that it was more representative. There are always limitations to different studies, so we do want to recognize that this was conducted using an online panel, so there could be some self-selection bias, and that as much as we put in We used accessibility tools and resources in the survey design and options for how people could participate. Respondents likely do not represent the experiences of individuals living with intellectual disabilities of a more moderate or severe nature. So we do absolutely recognize that. So I'm not going to go into a huge amount, but I do want to highlight a few of the details, or I guess key findings from the survey. So what you see in front of you here, in case you're wondering what is all of this. So every year, or not every year, every time we do the survey, we ask, have you thought about advanced care planning? So not even taken action, just have you thought about it? And consistently, the large majority of people have thought about it. So what you see is the 80% is in 2019. So that was, we have done polls before this, but we kind of are sticking with our three most recent ones. It dipped in 2021. I think we kind of had a lot on our minds in 2021. And then it went back up in 2024. And the reason you don't see different dates for the yellow, which is the responses from people living with a disability, is because we didn't have high enough response numbers in previous surveys to really pull out that group. So you'll see them only for the 2024 results. So there you see a higher number of people living with disabilities compared to the general population have thought about their future health and personal care needs. Who are Canadians talking to? So this is one where between 2019 and 2021, we saw pretty significant jumps. So the order of the years is a bit reversed in the table. So under general population, you'll see 2024 is the latest findings to the left. Sorry, it goes so the family, friends, healthcare providers, and then 2021. So you'll see jumps there in 2019 from 36% of people talking with family to 59% in 2021. So when we first saw that, we're like, okay, well, that's likely pandemic related, but it held pretty steady at 61%. So even though we saw really big jumps between 2019 and 2021 for conversations with family and close friends, those were maintained in 2024. So that's really encouraging. Conversations with lawyers and financial advisors went back down to pre-pandemic levels, but we continue to engage with them because their clients are still asking them about either financial matters or legal matters that might impact a person's ability to have those health and personal care wishes followed. And then on the right, you see people living with disabilities. And I think the main finding there is that it's fairly consistent with the numbers of the general population in terms of the order and the size of the people having those conversations. We also often ask people, when should Canadians start thinking about advanced care planning? And this has also held pretty steady. So most people believe that we should start doing this when we're healthy and well. So that would be nice in terms of the options that were provided. And then around 47. So midlife seems to be around the time that we typically believe that we should start thinking about this. This is a new question. We did not ask these types of questions in the past, but this was for us to try to better understand what's driving ACP conversations. So we asked a whole slew of questions about different motivations or beliefs or a sense of ability to participate. And I'm not going to go into that today because it can get quite complex, but I do want to draw your attention to the finding at the bottom. So we asked people whether they strongly agreed, or disagreed with these statements. And then one at the bottom talks about there is a need for more acceptance around sickness, death, dying, and expressing health or personal care needs in our society. And that was quite high. So general population 80, and those living with a disability 84%. So that is likely an evolution of what we've all recently lived through. I cannot say that for sure because, as I said, we have not asked these questions in the past, but this does provide us with an opening. It does provide us with an understanding that people may be ready to have these conversations in a way that they weren't before. We also ask if you have an advanced care plan. So this hasn't changed much since we've been doing our polling. So on average, about 1 in 5 people report having some type of documented advanced care plan. It is higher amongst women and those age 65 plus, and it's slightly higher for people living with a disability. So that was something else that came in our findings. But I've said this one has held pretty steady. When we look a little bit closer at the responses of people living with disabilities, more than 1/3 said that their disability had at least a moderate impact on their ability to engage in conversations about advanced care planning. So there's absolutely, again, thinking back to those barriers that we talked about from the Stats Canada surveys of people living with disabilities and some of the impact on that. So the communication barrier did show up in some of our findings. And then we asked some qualitative questions. This is by far not all of the responses, but some of the trends that would have come through those responses are certainly highlighted in these quotes. And so for the first one, I wouldn't know where to start or even who to go to. And I suspect it would probably be quite costly. So this is fairly consistent with feedback we've gotten through the polls over the years, that quite costly component. There's this impression that you have to work with a lawyer. You don't always have to work with a lawyer. So that gets really confusing and can be quite overwhelming. And so that is something that we have been working to simplify advanced care planning and educate individuals about how simple it can be and how there's different components. The second quote talks about how my healthcare is spread between so many different doctors. There is no one who has the complete knowledge of what is happening and who can provide me with the advice that I want and need. So that reality, think about the co-occurring disabilities, think about the aging population. We all know that our healthcare system is stretched. The services available in your region may look very different from the services available in another region. And so for those living with a disability, this is particularly challenging. So how can we think about that sharing of these ACPs with so many different providers? So thinking about not just advanced care planning itself, but that sharing of information and back and forth. And then last but not least, professionals may think I'm unable to make such decisions due to mental illness, but they would be wrong. I am lucid and stable enough to make said decisions. So this really hit home, and we heard quite a few comments like this. And this really anchors into the component of advanced care planning that focuses on capacity. So advanced care planning is letting people know what you would want if ever you were not able to communicate your own wishes for your future health and personal care. So who decides that? And what happens when somebody thinks you don't have capacity, but you do? You just need a little bit of help to express what you want to say, or that you're more than capable of understanding what's being presented to you. But people don't think that because of various perceptions. So I am going to stop sharing and I'm going to hand it over to Mary. So bear with us for a moment while we do a little bit of presentation swapping.
We do have a Q&A as well, Karen. I'm not sure if you wanted to answer that or if you'd like to leave that to the end.
Yeah, no, I can see it's about the statistics. So absolutely, I can take a look at that. So do you have statistics regarding the percentage of people become at some point unable to speak for themselves and require someone to speak on their behalf? How are people deemed to lack capacity to speak for themselves? And is that happening effectively? So no, first part of your question, we do not have that information. And then how are people deemed to lack capacity? There is protocols within healthcare settings as to who determines that. Is it happening effectively is part of what we have been trying to better understand. So I would say not necessarily, in the sense of, in part, what Mary's going to talk about with capacity and supported decision making. So again, I don't have stats or data on that, but based on the work of this project and consultations with people with self-advocates and disability groups, we've learned that that is a big barrier in terms of ableism, ageism, and interactions within healthcare systems. And sometimes it's also stress and anxiety and overwhelm of the staff working in the system, where they don't have the tools to maybe have a conversation with an individual because they don't have the right communication aids. And so they default to, I need to know this now, and they go with what is available right now. So it's a bit of a bigger question. But I would say it depends. It depends where you are and what system, but definitely there are conversations happening with caregivers that should be happening with individuals. So I'm thinking of long-term care homes where people come in and they are talking with the family member right away and not with the person who's living in the long-term care home. And sometimes it's that one decision can be made, but maybe done another, and then that changes the next day. So yeah, it's complex, and I think that's the big takeaway for us. It's not black and white. There's a lot of gray in there that we in advanced care planning really haven't unpacked or shone a light on, and that's part of what we're starting to do with this program. Thanks, Mary.
Thank you. So I'll just share my screen. And if there are any issues seeing it, just let me know. So as Karen mentioned, we have learned lots. I just see
We're
you've
just seeing
unmuted.
we're just seeing your, yeah. Even though we
Just
tested it,
presenter.
I know.
Yeah. There's that better. I don't think I have too many notes, but so as Karen mentioned, we have lots of project learnings. We're so lucky to work with the partners that we are working with. And some key aspects that have really come to the forefront include intersectionality and universal design. So this might be review for many of you, but if you aren't sure of what they are, intersectionality is a term coined by Dr. Kimberly Crenshaw. It's the idea that we're all made up of a number of different identities. These identities alone don't define someone because they all interconnect, they all intersect, and they impact the way that we view the world and the way the world views us. So on the right-hand side, there's a little diagram for intersectionality. And if I put myself in the blue circle, I'm a woman, I was born female, so I'm cisgender. I'm a younger individual. I'm not currently living with a disability. So when I move through the healthcare system, there are privileges that I hold. So since I'm younger and I don't live with a disability, my capacity isn't questioned. As a woman, there are some barriers I may face. I know some women have not been believed when they've gone into healthcare settings. So understanding an individual's background and how they come to your healthcare setting, or how you join the healthcare settings can all be impacted by these identities. Universal design is something that's really come to the forefront as well, and we have used throughout our project when we've updated our resources. So this is the design process and creation of products that everyone can use, and the use of these products is not dependent on age, size, ability, or disability. Something that is really important in terms of universal design is that it isn't just the end product, it's actually the process and creation of a product. So if you are making a program or if you're making intake forms, who is going to use that program or those intake forms, and can they help create those resources? Something that helped me understand it is automatic opening doors. So whether you are a wheelchair user, whether you walk in on two legs, or if you use a crutch, those doors will open. And something that Karen alluded to a little bit earlier is that universal design isn't just for the built environment, it's also for information technology, communication, and devices that can be used for communication, as well as the delivery of programs and services. So those two learnings have really come to the forefront. And like Karen mentioned, we are learning and still learning a lot more about supported decision making. So this actually came up at one of our project advisory group meetings, where an individual said that substitute decision making, a term very commonly used in advanced care planning, it might be called a proxy or a representative where you live, can actually be quite triggering and distressing for individuals, particularly those from the intellectual or developmental community, where they have been fighting for so long and continue to fight for their right to make healthcare decisions or decisions about their day-to-day life, that the thought of someone being able to come in and make those decisions was, again, distressing. So supported decision making is something that is changing across the country. It is in legislation in New Brunswick and BC, I believe. So at its core, what does it mean? It means that we all turn to the most important people in our life when facing difficult decisions. So I don't know many people that make very difficult decisions in isolation. Maybe you call your mom, your dad, your children, your neighbor. There's important people in your life that you like to hear their opinions, what their thoughts are, to help you make a decision. It ensures open conversations about care and future health with the patient, family, and healthcare team. And it also ensures open conversations with the important people in your life who you deem to be important. So maybe you have a support worker that knows you best. Maybe you have a neighbor that has gotten to know you as you've lived beside each other. So it's ensuring that the right people are in the room. It's a person-centered approach, ensuring the voice of the person you are supporting is at the center. So whether you're a patient, a client, or if you're supporting someone, they are in the driver's seat. And again, as Karen mentioned, everyone has capacity. Decisions might just need to be made with additional supports. And because capacity is so gray, it can be messy. Maybe there's a decision that can be made, today, but that same decision needs a little more support tomorrow. And that support might be providing the decision in plain language. So thinking about different ways that people can remain involved in their healthcare decisions. So we wanted to set up another poll just to learn more if you have heard of supported decision making, if you work from this approach. So if we could start that poll. Oh, perfect. Wow, lots of answers coming in right away. Thank you all so much for your engagement. So about 60-40, yes, 60% about have heard of it before, and 42% no. I'll maybe give a couple more seconds. So like I said, 57% said yes, 43% said no. So that's wonderful. We're all learning together, and thank you all so much for engaging. It's quite fun actually seeing all the answers come up really quickly. So the reason why we ask that is that supported decision-making, intersectionality, universal design are woven into a lot of our new and updated resources. So some of these new resources, number one, is our branding and our website. So one of the first tasks of our project was an accessibility audit. This essentially is just is our brand accessible? Is our website accessible? And unfortunately, the answer was no. So we knew right off the hop, those were going to be two items that had to be updated. So for our website, testing was done for screen reader compatibility and AODA, which is Accessibility for Ontario's Disabilities Act standards. So ensuring there is sufficient color contrast, the font styles are accessible and are legible, the sizes are larger as well, and use of white space. Our branding, which you can see on the left-hand side of the screen, was also reviewed for readability, color contrast accessibility, and our website as well. It was looked at to determine how many clicks does it take to access a certain page. So if you're trying to access one of our guides and you have to click, 30 times to get there, that isn't maybe as accessible as it could be. So our colors, again, work if you have varying levels of vision. Our website also has an accessibility toggle so that individuals can change it depending on what works best for them. So if you are prone to seizures, you can update the web page. We also have on the top right-hand corner a section where you can change the language of the web page, again, to ensure that the information you're receiving is in your most comfortable language. I believe we have 8 options at this time. So just to look at what the new website looks like. So much clearer use of white space, Something that was also updated is there are people on our website. We talk about how, people are integral to advanced care planning. It's important that you're talking to your family members, your friends, your chosen family about advanced care planning. So now you can see these individuals on our website from diverse backgrounds who are all engaging in advanced care planning differently. So one of our foundational resources that we updated, I'm not sure if anyone is familiar with the Speak Up workbook. It was a purple workbook. This is the newer version of that. This was completed in collaboration with Healthcare Human Factors out of the University Health Network. And it was also done in collaboration with individuals living with disabilities, caregivers, and the organizations that support them. That was done through focus groups, interviews, and we were able to gain some really key insights into how we could adapt the guide. So that included the fact that people need clarity in the process and goals of advanced care planning. So encouragement to reflect and plan through life's changes. With the life planning model, we acknowledge that life changes and it can change from day to day. So your advanced care plan will need to change along with it. Guidance is needed for people to explore their wishes and preferences and show how they connect to care choices. The guide also needs to emphasize the importance of choice and the fact that decisions made throughout are not set in stone. And people want the right knowledge at the right time in a way that feels personalized. And stories are key to understanding and bringing ACP to life. And we'll touch on that a little bit later. So what else has changed? We heard that the 5 steps of ACP, that the wording and the linear process was confusing. Of course, everyone is going to engage with advanced care planning differently. Maybe you start off with share and then you learn. Maybe you've already chosen someone that is going to be your decision maker and you just need to record. So on the right-hand side, you can see the updated model or diagram of the 5 processes of advanced care planning. So think, learn, choose. Choose was actually changed from decide. Decide felt too final. Share was changed from talk because not everyone talks to communicate. And then lastly, record. And with recording, it doesn't necessarily mean it has to be a document. Maybe you would like to write a song or a poem, or it could be a voice memo on your phone. Whatever is the easiest way for you to record your advanced care plan. And again, stories were overwhelmingly positively received. Why? Because it can help with the reflection process. It can also help make some of the more less tangible ideas tangible. It can help explain it in a grounded way as well, and can be great for comparing. Maybe you read a story and you think, oh, I would do the exact same thing, or maybe you would think I would do the total opposite, but it can be really good to hear different perspectives. So of course, the design and accessibility of the guide has been updated, and that's both for digital and analog accessibility. So whether you're going to use the guide online or if you print it off, it will be screen reader compatible. There is appropriate color contrast, font styles and sizes, and use of white space. The new guide is also more printer friendly, so there aren't large color blocks, and you can isolate the pages that you really wish to print off. So if it's page 22, then you can print page 22. So just for the interest of time, we have another story later on, so I am going to move through this, but this is one of, I believe, 5 or 6 stories that are throughout the guide. Again, someone from a different background who is thinking about advanced care planning and some of the steps that they take to get there. So as I mentioned, we've updated a lot of our resources based on the project learnings. And we've kind of lumped them into different sections, and one of these sections is guides. So the initial guide that I went through is our foundational main ACP guide, but some feedback we did receive was that it was too long. Because the font size is larger, because there's more use of white space, and because there's a lot more stories, the guide is quite long. We will admit that. So if you'd like a shorter version, we do have the mini guide. If you're an educator, if you run workshops, we also have the activity bundle. So pulled from that main guide are the activities throughout, so that maybe someone doesn't want to go through a whole guide right away. They just like to start thinking about advanced care planning. We also have a record booklet, which if you take a piece of paper and fold it in half, that's about the size, and it's 12 pages. So again, a much more condensed version. We also have some summaries. As Karen mentioned, there are legal aspects to advanced care planning. It doesn't mean necessarily that you have to go and speak to a lawyer, but there are some things that you do need to keep in mind. So we have put together plain language regional summaries. So for all jurisdictions across the country, we have put together what you legally need to know for your advanced care plan in your home province or territory. We also have a trifold brochure. So if you work somewhere where there's a waiting room, you can put those there. So if a patient client wants to learn more, if you are new to advanced care planning and just want a little bit of information, that can be helpful. A 2-page overview, same thing, just the condensed information. And we also have a legal terminology resource. So unfortunately, across the country, the terminology is different, and it can be quite confusing when you hear different terms across the country and from different people. So that's a resource to go through. What is it and where is it maybe most applicable? We also have handouts, our oversized postcard that has been updated as well. We did have a previous one with the Speak Up campaign and a bookmark. So lots of different resources that we have come out with. And then we also have a few more resources that are under development. So one of those is a new ACP video that is updating the 5 steps of advanced care planning, the video where someone is writing and drawing the 5 steps. An interactive online ACP guide. This is done in collaboration with Thrive Health, and that is a module format. So you can log in, go through the advanced care planning guide, save it, leave it, do something else, think about something else, and then come back to it. And it is also following the personal health information legislation, so ensuring that it is secure as well. We're also working on the supported decision-making resource for healthcare professionals with Inclusion Canada. As I mentioned, supported decision-making isn't legally recognized across the country. So if you are in a province where it isn't legally recognized, what does that look like and how can you support someone while still using supported decision-making principles? So there's going to be case studies, more information about what it is and why it's important. And lastly, we are working with All About Inclusion from Nova Scotia, and we're collaboratively creating an easy read ACP guide and conversation starters. These are visual communication guides, and it's also in collaboration with First People in Nova Scotia. So ensuring that the information is very clear, very concise, and that there's communication aids that can be used with it if that's your preferred way of communicating. We have the accessible advanced care planning learning community. So as we've mentioned, we have learned so much throughout this project, and we've been so lucky to work with such wonderful people that we'd like to share these learnings. Maybe you know everything about it, but would like a refresh, or maybe this is all new to you as well. It's an opportunity for people who work in healthcare, community and social services, and disability sectors to come together and learn more about what everyone is doing and build connections across sectors. In healthcare, there's lots of silos, unfortunately, and it's hard to know the great work that is being done across the country and globally. So it's always nice to know what resources there are if you're just learning about advanced care planning, or if you have important people in your life that would like to start. We also want to make sure that individuals with lived experience, caregivers, self-advocates, that they're involved as well, as you know, they are experts in what will work best for them. And so this is just the schedule. We've had 3 so far. So our first learning community was with 3 medical doctors from Dalhousie University. They created a resource for medical professionals to reflect on ableism in the healthcare system. Our second meeting was with an individual from the University of Waterloo discussing universal design. What does it actually look like in practice? And lastly, our latest meeting was January, and that was with a clinical and a bioethicist. There are ethical decisions that need to be made in advanced care planning, and just discussing how we navigate those ethical decisions as professionals, but also as family members. And lastly, we will have a accessible learning community session at the end of March, and that is with Inclusion Canada, discussing the supported decision-making resource and legal capacity in advanced care planning. So as I mentioned, we do have a story that we'd like to share. We'd just like to go through one of the activities in the guide. There's a couple of reflective questions. You don't need to answer them in the chat. This can just be for you to go through. So this activity is about choosing your decision maker, and I can read the story. Mo is driving back to the city after a fun day trip when they get in a car accident. They suffer a lot of injuries and arrive at the hospital unconscious. Emergency doctors need to perform critical surgeries to help them. The surgeries might impact their quality of life. The doctors contact Mo's mother, and she gives consent. When Mo recovers, they are upset to find out the choice for the surgery was made by their mother. They have not been in close contact with their mother for many years, and Mo's mother does not know what is important to them. So again, just reflective questions. You can think about them, type them on your phone, take a couple minutes. But if you were in Mo's position, who would you want the doctor to call? Do you think they would make the choices that you want? And is there anyone who you think would do a good job of making choices based on your wishes and everything that they know about you as a person and your preferences? So I'll leave that up for a little bit and give a few moments. And I did notice the chat as I was speaking, so I can jump there just to see if there's any questions.
Hey, Mary, I've been furiously answering some of the questions in the Q&A, so thank you. I think most of the questions in the chat have been answered, and we've gotten some nice feedback actually on the new resources, so it's been really nice.
Wonderful. Thank you. So we'll give it a couple moments, and we will also be sharing the slides afterwards. So if this is a bit heavy for a Tuesday afternoon, no problem at all. We can share the slides. So our next question, once I find my cursor, is in one word, and you can put this in the chat. You don't have to if you don't like to, but how did you feel completing this activity? Have you completed your advanced care plan so it was easy as anything? Was it a bit nerve-wracking? Happy to hear from everyone. Comfort, great. Thank you, Cassandra. Just a comment on the new resources. Confidence, fantastic. Pretty good. Yeah, you never really know how you're going to feel. Okay, question in the Q&A section. Empowered, fantastic. Yeah, it's nice to know and empowering to know that you can make these decisions and you can decide who decides for you if they have to. I've done ACP, but the questions were provocative and helpful. Felt like I needed more data and context. Absolutely. Our temporary decision maker hierarchy would prioritize a spouse over parents, but don't know if that's applicable in most case. For sure. So there are different legislations across the country. So we did try to make the guide as high level as possible, but that is a great point. It will look different wherever you're located. So thank you all so much for your great engagement. I think just based on time, we'll go to the next slide. So key takeaways. If you're just embarking on advanced care planning, or if you have done it before, it doesn't need to all be done at once. So start with manageable tasks. Maybe today you just think more about advanced care planning. Maybe you update your advanced care plan if this isn't new to you. Ask your family, friends, or others you care about what a good day looks like to them. It doesn't always have to be the sort of heavy questions. It can just be learning more about what's important to the important people in your life. So a good day for me, Karen and Tara know this, I'm a Timmy's fiend. So if I get my Timmy's, I've had a good day. Reflect on what good quality of life means to you, knowing as well that that will look different person to person. So if you are a healthcare provider joining us today, understanding that we can't create social change all at once, take it day by day and continue to learn, unlearn, and adapt. Maybe after the call today, make a pledge to change one aspect of your practice to be more accessible. Reflect on your social location and unconscious biases. So what would it be like if every time you entered a room, you were presumed to not have capacity to make your own decision? And to reconsider how you view disability. We all will live with a disability at some point in our lives, whether it's episodic, whether it's when we're older or currently. Do not let perfection get in the way of progress. Ask questions, and be open and transparent. So I'm sure Karen, Tara, and I would love to say that our resources are perfect. There's nothing wrong with them, but unfortunately that's not life. So we're always open to feedback, questions, and we know as well that things change in healthcare all the time. Work towards being as accessible as possible for as many people as possible from the start. So thinking about intersectionality, universal design, and supported decision-making, and how maybe you can integrate some of these pieces in your own work. So in the chat, again, maybe this is just reflecting to yourself, what would be your key takeaway? And while everyone is putting that in the chat, I can maybe quickly pass it back to Karen just to discuss some exciting dates ahead.
Thanks, Mary. I know we're just near the end of our hour, so we do get asked a lot about Advanced Care Planning Day, so it is on April 16th. Oh, I forgot to put 16 in the PowerPoint when I squeezed this slide in, so it is the 16th, same day every year. So for those of you who have engaged in the campaign last year, it's a very similar theme, but we added, if not now, when. So this is more inclusive of the full range of advanced care planning and people's tendency to put things off. We will have a check it off challenge. So this is a 30-day challenge that we will be encouraging Canadians to participate in that are very bite-sized small tasks that we think will help move towards different components of life planning. And the campaign kit is available. So if you would like to receive it to help do any type of promotion within your organization or community, you can send an email to info@advancedcareplanning.ca. And Tara can take care of sending that out to you. So that is absolutely available. For those of you who might have sent requests for printed copies of some of the materials that Mary provided an overview of, we just got a huge reprint done. So the demand for print was much higher than we anticipated. So Mary and Tara are working furiously to get those orders fulfilled. So if you do have Advanced Care Planning Day events where you would like some copies of the guide, please also reach out at info@advancedcareplanning.ca, and we can work to make sure that we get as many guides out to the folks who need them in advance of a very busy ACP Day season. So I see there's different things happening. I know we're right at 2 o'clock. I do just want to answer Gwen's question live. So your question is around the quote that I shared about the person living with a disability, and there's so many healthcare professionals. So there is a much greater focus on who are all the people who need to know. So instead of just narrowing in on who is your substitute decision maker, we really talk about who is your support network, who are the people who need to know, with a view that you are now thinking more broadly about all of those different people, and that your support network can take on some of that load of helping to communicate that if that's an option. So we recognize it looks and feels different for everybody, but we're hoping by really unpacking that part of the advanced care planning process that we try to tackle that a little bit better. Okay, I think everything else was answered in the Q&A. Just checking the chat. Are the resources available? Oh, yeah. Yes, some are available to be ordered hard copy. Not all of them, but we have updated the advanced care planning postcards of the 5 steps that used to be like rows, is now that graphic that Mary showed. So we have updated postcards, updated bookmarks, the guide, the mini guide. And if you're not sure, just send an email to info@advancedcareplanning.ca. We just kind of printed out a few, but thank you so much, everyone, for your support, for taking the time to join us here today. Please do not hesitate to reach out. We're always happy to do our best to support you in your work, and we really appreciate all of your efforts to really help spread advanced care planning across Canada. So thank you very much. With that, we will sign off and hope to engage with you again in the future. Have a great rest of your day.